Lance Lavelle, 7th grade science, Seaford Middle School.
I'm Tanya Levinson. I'm the clinical counselor at Millsboro Middle School in Indian River School District.
My name is Justin Tomlinson. I'm a health teacher at Millsboro Middle School.
My name is Josie Hunsberger, and I was a school counselor at Phyllis Wheatley Middle School.
I'm Jill Lewandowski. I'm a 7th grade English teacher at Woodbridge Middle School.
Harvey Doppelt. I'm with PBH. I'm director of the Specialized Services Unit at PBH, which includes the crisis service, which would be related to the suicide work. I am the project director and principal investigator of the grant, which we started in August 2011.
My name is Lisa Williams, and I began working with the Suicide Prevention Program from its inception. I worked there for 2 of the 3 years that the grant was funded for.
Our school was a school that was identified because of a recent suicide, and it was a subject that was on the mind of a lot of our students.
First off, I can't say enough good things about the Lifelines program. The neat thing about the Lifelines program is the actual concept it's based on, because any of you that have worked in a school setting realizes that there are a lot more kids than there are adults. So the kids inevitably know what's going on before the adults know what's going on. So the fact that the kids are being educated what to look for, the signs, the warning cues, all of that, and then really encouraged and reinforced to come to an adult for help, I think is great. So that's just very powerful.
I think just the biggest part about helping the students and relating to them is just showing compassion, that you're there for them and that you really care. So that's just the first start of that. But
I think it did help a lot of students find a voice.
It was nice for the kids to be taken seriously.
Giving the kids an outlet to actually have an honest, open conversation with their peers and with a trusted adult. That is a benefit in itself, because this is a conversation that most kids won't have.
Given what was going on at the time, a lot of the administration saw a need for it.
It's a community approach. By community approach, we are training the kids, we are training the school staff, and now be both educators, administrators, people working in the cafeteria, etc., because they need to be knowledgeable about suicide. And we would like to train all of the parents in that school community.
Which is us going in and just educating them so that they know what to look for, and that if they see these behaviors or warning signs in their friends, they now know what to do with it.
Definitely benefit for the staff, administration, parents, and especially for the students.
So that was the first concern, at least I have, is getting into the schools and being able to deliver the program.
I know a lot of staff members were concerned that the Lifelines program would bring that to the forefront, and it might become something on at the front of their minds. And it turned out to be the exact opposite. Not the act, but the act of prevention became their goal.
I think that it's really important that, again, obviously to even get in, you need administration. And I think we even need to look higher up. Like, I was thinking a lot about how, and maybe some of that information did go there, but starting even with the superintendents.
Things that we wouldn't have taken the time to notice that this program brought out.
We'll get texts from friends that say, I want to hurt myself, or I'm thinking of killing myself, or all of these other things, and don't tell anyone is the big thing. Don't tell anyone. So in middle school, because they're so peer-oriented, there's a lot of inner conflict with them about whether they should tell anyone. And one thing that I thought you did really, really great, really pounding home, and it was further reinforced by Mr. Tomlinson, is, how would you feel?
I really do like the relationship with kids, and I really feel like I have an opportunity as a health teacher to speak to them on these personal levels and health and just life in general. So it's kind of tough, I guess, to pass the ball to somebody else when I kind of want to take it myself and really and help the students. But I think just by the program coming into school really does help them, and even though I'm kind of limited with what I can say and do, it definitely does help the kids a lot.
The kids really enjoyed being able to ask their own questions. They enjoyed the safety of role play, but they were asking their own concerns within the scope of role play. if that makes any sense.
Yeah.
To give them a situation that might not be that dissimilar from their own, or a situation, you know, that is similar to something that they know somebody else has experienced, and to be able to ask the questions that they either wish they could have asked or they would want to ask, you know, or get the answers to. I think, you know, that's a powerful experience for the kids.
I would say they like to talk about, you know, who's close to them, who's their best friend, and who do they trust the most. It's not necessarily that they're kind of bragging or boasting, but they kind of just like to say, well, I have this person that's really close to me. And if there's someone that's maybe lacking on something that they can't really pick or choose someone that they're close with, you know, they can still, I guess, think that, well, it's important, I need to find this person, I need to find someone, or I need to go to someone in the guidance office, and that could be my trusted adult, I can look up to them. They like that a lot, I think, just to kind of know that they have somebody. And that's, I think, the people that might need it more than others. And that's what I see a lot with our groups of kids, sometimes classes of 32 kids. You know, maybe 10 of them don't have the best home life. So they're the ones that are more relating and maybe speaking up more than some kids that are maybe the more educated, that were more highly academic students, or maybe more sitting back and listening because they're not maybe quite as used to a broken home, or maybe a home that's got more struggles than their home life. So it's definitely a good dynamic at our school to see all the kids kind of picking and choosing what really helps them the most.
The trust doesn't just extend to suicide prevention. They ask questions about drug use, alcohol abuse. They ask questions about teen pregnancy. They ask all the questions that are on their mind because they've found that outlet for their knowledge. I really don't think there's a topic that they don't ask questions about. I even remember, it was actually after the program, but I heard kids asking themselves questions about homosexuality and the religious points, that tie in with all that. Like there's a social component that the kids are interested in too.
We expect kids to work in groups, but we don't teach them a group dynamic. So to ignore the social aspect, I feel, is to harm the kids. With the kids, some of them blossomed and were able to share more in that setting. Some of them, I think, closed in a little bit.
And it shocks me because middle schoolers tend to be sort of in the center of a lot of things, and a lot of them became, very aware of their surroundings and the differences between them and the person next to them, and the different lifestyles and problems that people in their community and their neighbors were facing.
It's very neat to see because in the middle school population they tend to be ethnocentric, very centered on themselves. It's all about them, and so the program took them out of themselves and into the culture of the school in general, and they became worried about their friends. And I know that it was definitely Lifelines that did it, because I would get kids to come to me and they would be talking about something along the lines of, oh my God, my friend, all she ever wanted was a pair of Uggs, and now she's got these Uggs and she's saying I can have the Uggs. Miss L, should I be worried? Should I be worried that she's going to do something? Or I've got a friend who, I know lunch sucks, but I'm not, she's not eating it. She's not been eating it for a week. And, she used to eat it, and I know she's depressed and there's a lot of stuff going on at home. Should I be worried about her? That kind of stuff. So when you look at the fact sheet, these kids really are taking the information you're giving them, and they're generalizing it, and it's soaking in, and they're coming to an adult.
A misleading part is we're focused on suicide is what Lifelines is, but what it is teaching are life skills. The most important life skills teaching is everyone needs someone to help them. Because one of the key parts of Lifelines is teaching the fellow students. If a friend comes to you and says, I'm thinking of hurting myself, or you observe that, what do you do? In Lifelines, the answer would be you try to encourage a friend to go forward with you and get help.
It did provide a voice for students that would otherwise probably just sit idle.
We heard a lot more about family members or friends, connections they had to people who had either committed suicide or had attempted suicide. And that's something we wouldn't have asked. We were able to find out how much it's on their mind.
A lot of them would say, well, I have a friend who completed suicide, but they didn't exhibit any warning signs at all. That would come up with both teachers and students. And while we are certain that there are some cases where there were no warning signs, we know too that the research shows us that there certainly are a lot of warning signs. Unfortunately, sometimes if we don't know what they are before, then it's hard to recognize and do anything about.
A lot of times aren't even able to focus on what they're supposed to be learning because they're thinking about like what their friend told them last night or what somebody posted on Facebook and they're upset about it.
I think that as a result, a lot of the adults in the building did become more compassionate, more understanding.
I was able to understand why, okay, so this is why the work is going like this. And maybe on the times when she's down, I shouldn't be saying, oh, you're slacking off, you know, what? Do your homework, blah, blah, blah. Maybe I should be saying, are you okay? Do you need to talk about it? What's going on?
Well, I think initially, and even part of the issue of getting it into the schools was just fears, being uncomfortable, concern, I know by some of the staff, like, oh, is this going to bring up, like, and how are we going to deal with this? And also that concern from parents.
This program gave us a pause.
Being in the school, I think the BHCs do have a certain insight into students and the culture of the school that an outsider doesn't have.
It's just that we need to keep doing things throughout the year that keep, you know, and I don't want it to get like where kids get indifferent. Like I feel like kids get indifferent to violence because they see it all the time. So I don't want it to be like, oh, not another one of these. But something that just sort of gets them, you know.
I think we've done a lot of good. And what I cannot prove unequivocally is that I've stopped, through the efforts of the trainers and all the kids trained, stopped any suicides. Do I believe we have? Yes.
Do not be afraid to ask directly, are you thinking about suicide? I know as clinicians sometimes we may tend to shy away from that, but we have to ask them. If we see the warning signs, we need to ask and we need to get an answer.
It can't be a one-shot deal. It can't be a one-shot.
It has to continue. I mean, we've done it for 3 years. If it dries up now, it will not be good for the next generation of kids going through middle school.
It's just always worth trying different things and just hanging in there, not giving up. And it's hard not to sometimes. But
Don't assume that all the students that you're working with know how to practice healthy coping skills. I'm always going over, reviewing.
start out with the support of the staff because, you know, trying to figure out how to, you know, and hear what they have to say.
It helped me as a staff member in the building realize that even the students who are trying to change the culture need somebody to talk to. And so it helped me realize that the students who need the help aren't necessarily the ones that you would think.
I would say just be open, be honest. You know, don't try to sugarcoat things to the students because most of them, you know, have watched tons of YouTube clips. Most of them have scanned the internet for hours, and they've seen a lot of real life situations out there. So I think most students just want to hear the truth. They want to hear the ins and outs of why you're there, not necessarily beat around the bush and say, you know, if this could happen, to say this is happening. We're experiencing these issues, and it's important to know about them so that if something's happening in your life, you're able to address it the right way.
Despite many of the students experiencing some relationship to suicide, whether a family member, whether a friend, or some other colleague telling them about it, and that's again where the strength of Lifelines comes in, because we want to harness that information and get the kids professional help.